In terms of the study, we had 3 sites, and children and adolescents that ranged in age from 7 to 17 were recruited. Children had to have obsessive compulsive disorder. When they came to us, they had to be treatment naive. They couldn't be on treatment. And then we randomly assigned them to one of 4 conditions, either a placebo, a pill placebo, sertraline, cognitive behavioral therapy, or the combination of cognitive behavioral therapy and sertraline. The original outcome paper was published several years ago, and in that paper we found that overall cognitive behavioral therapy or cognitive behavioral therapy plus sertraline was probably the best first-line treatment for kids in general. For this study, we looked more specifically at whether there were characteristics of children that could predict which children did better in which treatments. And so in this study, we found that in fact there were characteristics of children and adolescents that could help us determine which treatment to apply first. So in terms of general findings, we found that kids who had less severe symptoms initially, kids whose symptoms interfered less with their daily functioning, and kids who had fewer co-occurring behavior problems did better across all treatments that we studied. In addition, kids who were able to recognize their symptoms as irrational and kids whose families accommodated their symptoms less also did better across all treatments. I think the implications come from one finding that allowed us to discriminate among treatments. And in that finding, we were able to show that kids who had a family history of obsessive compulsive disorder, that means a parent or a sibling who had OCD, they did 6 times worse in cognitive behavioral monotherapy, so just cognitive behavioral therapy, than their counterparts who didn't have a family history of OCD. So I would say the real take-home message here is that if you are the parent of a child with OCD and you yourself or one of the child's siblings has OCD, it might be a good idea to talk with your doctor carefully about possibly combining cognitive behavioral therapy with medication.